Good day, clients, patients, friends, and neighbors. My name is Dr. Amanda Ennis, and today I would like to share with you a little bit about the importance of the physical examination in the cat and explain what we are actually doing during the physical exam and some things that we are looking for. So to demonstrate today, I have my own wonderful feline, Wonton. He is a hairless Sphynx cat. To get started, I'll put him on the table. Now, to get started, for my physical exam, I usually begin at the head of the patient and move to the rear. First, I will use an ophthalmoscope to look at Wonton's eyes, looking for aging changes, cataracts, redness, and making sure I check the fundus of the eye, which is the back of the eye, to make sure that everything looks normal. Usually involves me getting very close to the eyes of patients. But Wonton's fundic exam and ophthalmic exam is normal. Next, I like to check the teeth. Healthy cats should have minimal or no tartar or gingivitis and typically allow a good oral exam of both the front and the back of the mouth. Wonton, I'll tilt his head up a little bit. I'll pull back his gums, and looking here, he doesn't have any gingivitis at the gum line, and he has not very much tartar, maybe a little bit on the back premolars. If there is significant dental disease, tartar or gingivitis, we might need to have a discussion about home dental care or a professional dental cleaning. Lastly, around the face, I will check the ears using a long-handled Q-tip. You can use a plain one too if you're doing this at home, but I will tilt the ear back, advance the Q-tip into the ear, and swab around. Wonton had a good chunk of debris in there, so I'm happy I got it out. So now we can move on to the next areas of the body. Using my stethoscope, I will listen to your pet's heart and lungs, checking for heart murmurs, arrhythmias of the heart, crackles or wheezes in the lungs. And if any of those abnormalities exist, we may need to discuss heart disease or lung disease in cats and what can be done to better diagnose and treat the problem. Usually at the same time that I listen to the heart and lungs, I'll take a feel of the patient's windpipe just to make sure that I can't elicit any sort of cough. That can sometimes be an indicator of airway disease. There's 4 quadrants of the heart and lungs that I listen to, so I'm just going ahead and doing that now for Wonton. So he sounds good. And as I said, I'll feel his windpipe just to make sure that everything feels normal there. Okay, so all is normal. So I'm going to move on to my abdominal palpation. And I think some people during this time kind of think it looks like I'm randomly squeezing your cat's belly or your dog's belly. But really, I'm looking for any obvious organ enlargement, masses in the belly, feeling the bladder for size and shape, and checking for any potential sources of pain. Wonton has just eaten. So I like to do a one-handed palpation, but some doctors will do a two-handed palpation. This would be a technique for a two-handed palpation. It shouldn't hurt, and Wonton, I think, is being a pretty good boy today. So after that, he feels fine internally. So usually my last step is to run my hands all over your cat's body. I'm really checking for locations of common external lymph nodes. You really shouldn't feel them in a normal cat, but sometimes if there's abnormalities, you will. So in cats, I also like to take a comb, a flea comb, or some sort of soft bristled comb to the coat and run my comb down the coat to check for any sorts of fleas, any sorts of areas of hair loss. But as you can see, since Wonton's hairless, he doesn't need the flea comb. Finally, the best for last, I typically take all dogs and cats' temperatures when they come in for a physical exam. So normal body temperature for a dog or cat is 100 to 102.5, so that's a little hotter than our body temperature. And typically we will take the temperature rectally because that's the most effective way to do it. Some cats are motivated by food. So for Wonton, I have a feeling he might be good for this if I feed him. I think he's looking for more food. Good. So his body temperature is normal. It's 102. So everything looks fine for this patient, which is good because he's my cat. Thanks everyone for tuning in, and check out the next series of videos if you're interested in ear cleanings on the cat, nail trims in the cat, anal gland expression, blood draws, and IV catheter placement. I'm Dr. Amanda Ennis from Metropolitan Veterinary Center.